All right, guys, welcome to our Let's Talk About Poop podcast, where every Monday I go live on my social media streams and also post this on my podcast as well. We have a great show today. We'll talk about what exactly is the gut microbiome. We'll discuss ways your gut microbiome may be not working correctly and recommendations that I recommend as a GI doctor to get your gut microbiome back on track. We'll discuss exactly what we can do to hopefully help out when it comes to swallowing issues. So if you have trouble swallowing, or you know somebody has swallowing issues or painful swallowing, we'll go through a case together about what that could mean. We'll discuss the new recommendations that just came out in the past couple of months about 2 new over-the-counter options to help out when it comes to constipation. We'll discuss some of the high fiber foods that I recommend. It's hard to include these foods in your diet, and we'll answer your questions live as well. So if you're joining for the first time, my name is Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic. I have over 10 years of treating GI patients all across the spectrum of all sorts of GI issues. I've been doing this for a long time. If you're here locally in Lubbock, come see us at Lubbock Gastro. Our office number is 806-696-4440. And if you're watching this live on my live streams or on TikTok or anywhere else, let me know if you're watching this live or on the replay, and also let me know where you guys are watching this at as well. So a couple of housekeeping things. If you have any GI issues, if you have any gut issues, and you're here locally, come see us. We're open to see patients who have all sorts of issues going on inside their GI tract. I am so sad that the Olympics are done. I have been obsessed with the Olympics for the past 2 weeks. I'm like an Olympic fanatic, and I think the most important thing, or the most exciting thing that I have found about the Olympics is getting exposed to a lot of the different sports that I never would have been exposed to in the past. Things like water polo, handball, breakdancing, which is happening over the weekend. So let me know in the comments, either on TikTok if you're watching on TikTok or on my live streams as well, which Olympic sport did you enjoy? Let me know in the comments down below, because I would love to hear what you guys think as well, or kind of what your favorite sport was that you saw on the on Olympics as well. Going back to my movies, so we're going through a Coen Brothers movie streak. So over the weekend, I saw a classic, The Big Lebowski. I love that movie. I saw it back when I was in high school, so it was kind of nice to relive that movie. Obviously, with me much older, with much different priorities than what I had in high school. But give me some movie recommendations you guys have as well. All right, so let's go and get started on our topics today. So the first topic that we'll talk about is your gut microbiome. So let's get into that. So what we'll talk today is about what exactly is the gut microbiome. I'm going to give you 8 signs or symptoms that you may not be aware of that could be a sign that your gut microbiome is out of whack. And we'll discuss 7 recommendations that I recommend if you have food, the environment, stress, and all of what's going on inside your GI tract. We're discovering that the gut microbiome really is the root for a lot of issues in the gut. We're also seeing that how it can affect things going outside the gut as well. And so we're trying to find ways to help manage what is going on inside the GI tract. But a lot of my patients don't realize that the gut microbiome actually could be the root cause of why they're having their issues. I truly believe that's the case. So let's go through 8 symptoms that you may be having that could give you an understanding that the gut microbiome is actually the cause for your issues. Number 1, obviously, is digestive issues. So things like bloating, distension, heartburn, reflux, nausea, constipation, diarrhea, everything. If you have a GI issue or something's going on, there's an excellent chance that your gut microbiome could be playing a role when it comes to that. And this may be one of the reasons why, or one of the explanations of why you may not be responding to some of the traditional treatments that we have when it comes to treating GI issues, because we're not actually delving into the root cause or the root treatment. Number 2 is weight changes. So weight changes in general, up and down, fluctuating weight changes can be sourced also to what's going on in your gut microbiome. Now, I know a lot of us, before the advent of medications like Wegovy or Ozempic, we're struggling with weight gain. But even with that, you may be having fluctuations of weight. And what we're seeing is that sometimes the weight changes up and down. The root cause are the different bacteria that you have going on inside your environment that's playing a significant role. Number 3 are food intolerances. Have you noticed if you have gluten, if you have dairy, if you have certain carbohydrates, you feel bad, you feel distended, you feel bloated? Well, the root cause, once again, can also be attributed to the gut microbiome. So if you have this issue and you're wondering why do I have it, your gut microbiome, frankly, could be the role of the reason that you have it. If you're chronically fatigued, if you're tired all the time. Now, there are a lot of reasons why you're tired. I'm tired, you're tired, we all have things going on. But chronic fatigue, if there's no explanation, can actually be due to what's going on inside your gut. We've seen recent studies in which the proportion of good bacteria to bad bacteria can correlate to the severity of how tired and fatigued you are. So chronic fatigue, especially if it's unexplained, can be the sign of what's something going on inside your GI tract. Number 5 are skin problems. So a lot of individuals have skin problems, whether it's psoriasis, dandruff, dry skin, acne, autoimmune diseases, eczema. And we are discovering that this is really could be going down to the root cause of your GI tract. I've had individual patients who we treat their gut issues by fixing the gut microbiome, and they've noticed their skin feels better and it looks better. Let me give you a story about myself. So in the past, I had a lot of skin issues. I had acne, I had dry skin, I had some eczema. And I'll tell you, when I was younger, I did not eat the best. I always went out to eat. I had fast food, I had hamburgers, I had hot dogs, I had chips. I did not, eat the best at all. But when I made a concerted effort to adjust how I ate, what I ate, and make the difference for that, that really altered my skin and how it appeared. I had less acne, I had less eczema. I felt better overall. And I really do believe that how I changed inside my gut affected how I felt and looked on the outside. If you have autoimmune problems, a lot of autoimmune problems we're discovering has a role when it comes to your GI tract. Now, I'm not saying that we can cure autoimmune diseases by adjusting your GI tract, but what I am saying is that we're seeing more and more evidence of how the autoimmune diseases can be related to what's going on inside your gut. Number 7, we're seeing some evidence that in things like anxiety, depression, being anxious can play a role in terms of the cause can be due to what's going on inside your gut. Now, this is very early research that we're finding, but it's fascinating to see how what is going on inside your gut can affect how you feel mentally. And we do know that the more stressed that you are, that does change the natural course of how your gut microbiome is as well. A lot more bad bacteria and a lot less good bacteria. And then lastly, frequent infections. If you're sick all the time, you always have a cold, the flu, you just don't feel good. Those frequent infections, the root cause for that can really be due to what is going on inside your GI tract. So now that I kind of gave you the 8 signs, what can you do? Here are my 7 tips that I recommend to all my patients in my 10 years of treating GI patients on how I want to get their gut microbiome back on track. So tip number 1, the best thing, the most important thing you can do is have a very diverse diet. Studies after studies and studies have shown that those individuals that have a wide variety of plants and vegetables, different types, different colors, different flavors, their stool ends up being the most diverse. And we want to aim for a diverse stool. You want a rainbow of a stool. You want diversity. You want everyone to be happy. And you want as much gut bacteria that's inside your gut. And the best predictor of that by far is to have a diet that is diversified. Number 2, incorporate a plant-based diet. Now, I live in Texas, and I know it is hard in the South to have mainly a plant-based diet. I know this, and it's hard. My recommendation to you is do as best as you can. Incorporate those plants. Make the plants the vast majority of the plate. Make it the biggest portion of your plate and try to have plants every single meal. If you do this, you're doing better than 90% of the people that are out there. Tip number 3, consume fermented foods. So fermented foods are nature's superpower to give you exactly what you need. It has prebiotics, it's got probiotics, it's got vitamins, it's got minerals, and it's great for you. And this is nature's way of giving you a superpower in the foods to get you feeling better. So things that are fermented are going to be the best thing for you. Next is that you want to limit the processed sugars and the processed foods. These are destroying your GI tract. So excess sugars, foods from fast foods, foods from other places, this is completely destroying your GI tract. So let me tell you a story about a patient of mine. I had an individual that came to see me that was having all sorts of GI issues, nausea, vomiting, bloating, distension, and also having heartburn and just all sorts of problems. And his diet was out of whack. I told him, there's so many things I can tell you. I want you to do one thing. I don't want you to have any more fast food for the next 30 days. That's it. If you do this thing, I want to see how you feel. So I made him commit to not having more fast food. 1 month later, guess what? He lost weight, he had more energy, he felt better, and his GI issues got better. So the fast food that you're having is full of the processed foods and the sugary foods. So if you can just eliminate that one thing, you're doing so much better when it comes to your GI tract. Number 6, I want you to stay hydrated. Hydration is important for your overall health. It's also important for your GI tract as well. The more dehydrated you are, the more stress you have in your body, and the worse it's going to be for your gut microbiome. So what I recommend to all my patients, have 2 cups of water in the morning, 1 cup before each meal, and 2 cups before you go to bed. This is the best way to give you the hydration that you need. Next, make sure you exercise regularly. Every single day. I want you to commit every single day. Even if something as small as walking is better than nothing. And when you look at the benefits of exercise on your gut microbiome, you don't have to lose weight. You don't have to, gain muscle. The physical act of exercising is enough to get you where you need to be as well. And then lastly, I cannot stress this enough, sleep. You need to make sure you have sleep. In my opinion, sleep is the foundation for pretty much everything when it comes to health decisions. You sleep better, you look better, you feel better, you can fight off more infections. Overall, you're doing good. And without that foundation of sleep, things get impaired. And so if you can do these things, this will be the way for you to hopefully get your GI tract back on track and get you feeling better as well. Let me know in the comments down below, would you add anything to these recommendations that I recommended to change your gut microbiome? What has worked for you? What hasn't worked for you? Comment down below. I would love to hear what you got to have to say. Once again, if you're watching on the live stream, hello guys on TikTok, and also hello guys on my social media streams. I'm Dr. Islam. I'm board certified gastroenterologist trained at the Mayo Clinic. Let me know if you're watching this live or in the replay, and also let me know where you guys are watching this at as well. All right. Next topic that we'll talk about is painful swallowing. So let me know in the comments if you guys have ever suffered painful swallowing. So there are a lot of reasons why people can have painful swallowing. And there's a lot of reasons why this could be the cause for this. Let's talk about this. So what exactly do I mean when I say that you have painful swallowing? The medical term for this is called odynophagia, which literally is painful swallowing. This is different from what's called dysphagia, which is difficulty swallowing. Now, there's a very small amount of things that can cause painful swallowing. And so some of those really can include things that we ingest. So let me tell you a story of a patient of mine. So this week, I had a 27-year-old patient who came to see me who was having painful swallowing. It hurt when things were going down. She's like, oh my gosh, Dr. Islam, when I swallow, when it gets to my chest, it physically hurts. It is not good. Now, she was taking different medications, including a recent medication for an infection called doxycycline. And so she got an evaluation by her PCP, who went ahead and told her to go ahead and got an x-ray, did some blood testing, didn't see anything worrisome, and came to see me. So when this patient came to see me, I was understanding, okay, she's got painful swallowing. What is going on? And so when you think about painful swallowing, there are very few things in the GI world that can cause that. So one is infection. So if you have some sort of infection going on inside your esophagus, that can cause painful swallowing. The most common infections being candida. Yes, you can have diaper rash in your esophagus. The most common symptom from this is painful swallowing. This is very commonly associated with those individuals who take a breathing treatment for inhaler. They can get a candida infection that's there. But other infections, including different viruses like herpes virus or CMV, these can also cause painful swallowing. Number 2 is chronic acid reflux. If you have ulcers or inflammation from chronic acid reflux, that can make it hurt to swallow as well. Number 3, if you have a problem with something getting stuck inside the esophagus and it causes irritation to occur. So medications is in the spectrum of things that can cause painful swallowing. And there are a couple of classic medications that we know that can do that. One of them is bisphosphonates. So if you take medications for osteoporosis, that big old pill, that horse pill, that can cause painful swallowing, especially if you get stuck. If you take potassium pills, this can also cause painful swallowing, especially when it gets stuck. But also antibiotics like doxycycline, like the one this individual took, this can cause painful swallowing to occur as well. And this also may be something that can cause these issues to occur. So what do we do? So when I see somebody who comes to see me for painful swallowing, I want to take a look and see what's going on. So I do what's called an upper endoscopy or an EGD. I physically take a look and see what's going on so I can see, number one, does it confirm my suspicion? There's something going on there. Number two, can I rule out other more nefarious causes for painful swallowing? And number three, can I maybe take some biopsies if I need to? So on this individual, we did an upper endoscopy. And yes, I saw ulcers inside that esophagus that were due to the doxycycline that she took. So she actually was taking a medication that caused the painful swallowing. And so because of that, we knew exactly what it is. So what do we do for this patient? Well, we want to give them pain, something to help pain control. So sometimes we'll give them green goddess or pink goddess to help soothe the esophagus to make it better. We do want to consider at least reducing acid therapy at that time, because you don't want to make the problem worse by having patients having more acid reflux as well. And then number three, give it some time. A tincture of time will get this taken care of. But let me stress a couple of things for you. Number one, you need to always make sure that if you're having painful swallowing, that you don't ignore it, because there are other reasons why this can be the case. The most serious condition is having a cancer inside that esophagus. That is probably the most serious reason why people can have painful swallowing. If that's the case, you don't want to ignore that. And so this is why in these individuals, we typically would recommend for us to take a look, see a GI doctor so we can see exactly what's going on and hopefully get things taken care of for you as well. All right, perfect. All right, next topic we'll talk about some of the new recommendations when it comes to constipation for my patients. So you guys know me. I am trying to do what I can to stay as updated as I can on all the research when it comes to GI. So our big GI societies, the AGA and the ACG, so the American College or the American Gastroenterology Association and the American College of Gastroenterologists came up with new guidelines on recommendations to help treat constipation. And I know a lot of you guys are suffering from this because you come see me for your constipation issues. And so they actually recommended two other options for constipation, magnesium oxide and senna. We'll talk about that in more detail as well. But also, they also talked about other options when it comes to constipation. So what exactly is magnesium oxide? So magnesium oxide is a very safe over-the-counter treatment that we typically use for constipation. It does two things for your bowels. Number one, helps to soften the stool to make it easier for stools to pass. But not only that, it actually can help to stimulate the gut by bringing in water into the gut. Now that magnesium is a component which very commonly is an effective option to help treat constipation. In fact, for a lot of my patients, I recommend this, and it's nice to hear that we have new guidelines to suggest that we can use magnesium to help out when it comes to constipation. Now, when I have patients who I recommend this, there are a couple things that we want you to do. So number one, always keep in mind that it's good to take this at night, because at least with night, there's also evidence that magnesium can help you sleep as well. So when I have patients take it at night, we're killing two birds with one stone. We're helping out with your constipation so that by the time you get up in the morning, you'll have a bowel movement, but also we can help you to sleep whenever you go to bed. We also recommend starting off with maybe around 2 to 4 pills per day, about 200 to 400 milligrams per night. And you can titrate up to as high as you need to, up to 1,500 milligrams, or until you can have a good bowel movement. So I try to stress to my patients, you titrate this up yourself based on your own bowel movements. Now, this medication itself is not without its own side effects. So for some individuals, it can cause an upset stomach, indigestion, and pain, but also it can make your magnesium levels very, very high. So if you're going to do this, number one, always make sure you speak to your doctor about starting a new regimen, including a supplement like this. And number two, it may be worthwhile to check a magnesium level once you get to a level that's therapeutic for you, that you feel good, and that you have a good bowel movement as well. But I've used this commonly for a lot of my patients when it comes to bowel issues to get them feeling better as well. So it's something I do recommend when it comes to treating GI issues and constipation naturally. Now, the second recommendation that came out is using senna. So senna has been used for centuries when it comes to constipation. It is a plant-based medication that's natural that can get you going to the restroom. And what it does helps to stimulate the gut to allow things to flow easier and to flow better as well. Once again, a side effect can be cramping, when it comes to this. So kind of be aware of that as well. But these are 2 things that I recommend in my own patients when it comes to constipation and dealing with those issues. And if you're having issues with constipation, obviously come see us where we can find out what's going on, because I don't want to just treat the symptoms. I want to get down to the root cause of why you're having the constipation. So we may do an evaluation. So if you're having these issues, come see us at Love Gastro. We can find out exactly what we can do to hopefully get things taken care of for you as well. All right. Last topic before we go into some of the questions you guys have here. How do we add in fiber foods? So if you have been part of my channel and my social media and my videos, you know that I am a fiber fanatic. So I have a lot of patients who tell me, hey, Dr. Islam, I would love to have fiber, but I don't know how to do it. There's so many options. So I'm going to give you 13 simple foods that are packed full of fiber that you can do and hopefully incorporate into your diet. Pick 1, pick 2, pick 10, find some, add it to your diet. Food number 1, avocados. I love avocados. They're great. They're full of fiber. They're full of healthy fat. They taste good. They're yummy, and they're easy to incorporate into your diet. And so if you just add this to your lunch, use this as a smear instead of mayonnaise, you're getting the benefit of getting avocados. So avocados are packed full of fiber. They're low carb. Use them. Number 2, raspberries. I love raspberries. They're great. This is nature's other superfood. Berries are great foods, and raspberries are excellent. They're a great source of vitamin K. They're one of the highest. They are one of the highest fruits with fiber. They have powerful antioxidants, help fight off inflammation, fight off infection, and get you feeling better. Number 3, chia seeds. Easy. You can do this anywhere. There's no excuse why you cannot use chia seeds. Add it to your salad. Add it to your smoothie. Add it to anything. This can also give you the benefit of a heart benefit as well. So try to incorporate chia seeds. Number 4, lentils. I just had lentil soup, and I love lentils. Have this as a soup. Have this as a snack. Have this as a meal. They are low calorie. They're high in protein, and they're high in fiber as well. And by having that protein and fiber, it'll actually make you feel fuller, longer, and more often. Number 5, kiwis. Kiwis are packed full of fiber. They're great for you, and they're good for your gut microbiome as well. And if you're having issues with constipation, kiwis is a great natural way to help treat the constipation. I've had so many patients on kiwis, in which they get a lot of benefit from that. Number 6, black beans. This is one of the highest fiber-dense foods you can have in there. Not only can you have the fiber with black beans, you can incorporate this in any meal, add it to your nachos if you want to, and it also has a lot of vitamins, antioxidants, and minerals in them as well. Next are blackberries. I love blackberries. Now, blackberries also are high in vitamin C. If you add this to raspberries, we have the double combination of the benefits of the fiber, the antioxidants, the nutrients, and the ingredients. And this can also change what is going on in your gut microbiome. Next are whole grains. So not all carbs are bad. I want to stress this. And whole grains like oats, wheat, barley, these are grains that are good for you. And I love to have grains. I love my carbs. And these are the ones that I recommend when it comes to helping out with my fiber as well. Next is acorn squash. This has high levels of fiber, vitamins and minerals, and you can also add this as a garnish to your meal. Next are artichokes. Now, I am not a fan of artichokes. In fact, I don't like artichokes. They taste kind of nasty, but that's me. For you, you may enjoy those artichokes. They're also low in carbohydrates, so if you're not wanting to gain weight, this may be an effective option as well. Next is flaxseed. Once again, easy to incorporate, easy to add it into smoothies, to salads, to lunch. And this would actually be a very good option to minimize the blood sugar highs that can occur after your meal. Next is guava, which I love. I love guava. High in fiber, high in protein, can help you to feel fuller longer and more often, and can help out when it comes to blood sugar issues as well. And then lastly, one of my favorites are dates. Dates are kind of part of the family of prunes. These are also packed with fiber, packed with good sugars, and packed with nutrients. And so once again, also, dates can help out when it comes to constipation. And in fact, if you have 2 to 4 dates per day, this is also a natural way to get your constipation taken care of as well. So let's go into some of the live streams, ask some of the questions as well. So one question Nathan asked, how does artificial sweeteners change the gut microbiome? This is a great question. So this is one of those questions in which we want to kind of delve into the difference between the forest and the trees. So when I say this, we do have clinical evidence that artificial sweeteners on a microscopic level and on a gut level does change your gut microbiome. We're seeing more and more evidence for this, and that's true. But then the big question is, who gives a flip? What are the long-term consequences? And I'll tell you, we don't have any good clinical consequences of having that change in the gut microbiome, specifically for artificial sweeteners. We know overall, if you have a change in the gut microbiome, it may cause bloating, distension, diarrhea, things like that. But having artificial sweeteners and having that minute change in the gut microbiome, we have no evidence right now that it's going to change overall the clinical picture. So what do? Well, I'll tell you, if it's a choice between having real sugar or artificial sweeteners, go for the artificial sweeteners. If it's a choice between having a Coke and a Diet Coke with artificial sweeteners, do the artificial sweeteners. There's better benefits, less calories, and good for you. I do Splenda myself, and I know that's a shock as a GI doctor. I don't care because I don't have any long-term consequences from that. I do have to stress, though, that for those individuals who have bloating and diarrhea or have been diagnosed with IBS, you actually may be more sensitive to other people. And so one of the first things I recommend for those individuals with symptoms is to stop those artificial sweeteners, because that could be the root cause of what's going on. That can also lead to problems down the road. So use your body as the guide to see if you need to be on some sort of artificial sweetener or not. That's the best way and the best advice that I recommend for that. So that's a great question. All right. Perfect. I'm going through some of the live here. All right, perfect. Let's see. Next question I got is, let me take a look here and see. Let me go through my list here. Hey, Dr. Islam, what are the effects of taking NSAIDs daily? So NSAIDs are non-steroidal anti-inflammatory drugs, so things like Aleve, naproxen, Advil, Motrin, which commonly we use for pain, joint issues, and problems like that, but they can have their own effect on the gut. So long-term NSAID use has a risk of causing a couple of different symptoms inside the stomach. Number one, it can cause gastritis or inflammation in the stomach. Number two, it can cause inflammation in the esophagus, including esophagitis. Number three, it can cause ulcers to occur. Number four, it can cause issues when it comes to having abdominal pain. And number five, it can make indigestion worse. So for all my patients in which I take a look and they're having symptoms, or I take a look and I see inflammation, one of the first questions I ask, hey, are you taking any type of NSAID medication? If you are, that's an easy fix because we want you to stop that. Now, you can certainly substitute Tylenol as long as you take it in the recommended dosage, but taking NSAIDs is detrimental. If you are one of those individuals in which you have to be on an NSAID and it helps out with your symptoms and you don't want to get off or you can't, at that point in time, then we'd recommend for you to be on an acid-reducing medication like a PPI. And what this will do, it will blunt the effect, or at least minimize some of the effects you may be having from being on that NSAID. But if you're having GI issues, especially pain, the easiest thing you can do is to stop that NSAID so you're not having those symptoms that are occurring as well. That's the easiest thing you can do. But if you need to be on it, then we may want to consider putting you on an acid medication instead. Great question here. All right, any other questions here? Let's see. All right. Hey, Dr. Islam, are long-term PPIs bad for you? All right, I love this question because literally every single patient who comes to see me who has heartburn and indigestion either wants this question answered, asks me this question, or is thinking about it. I know you are. So here's what we know about PPI. So there are some side effects you should be aware of. There is a risk of certain vitamin deficiencies. Calcium, magnesium, vitamin D are the big ones, and B12. Number two, there are some risk of infections, pneumonia in the first 30 days, C. difficile infection, enteric infections inside your gut. Next, there is a concern about interstitial nephritis or inflammation, or kind of inflammation going on inside your kidneys. We also know that for postmenopausal women, there is a concern developing osteoporosis. That's there. We do know there is no risk factor for Alzheimer's. We do know there is no risk factor for anything else, Alzheimer's as well. So we do know that's the case. And so what we do know now is that this is what we do recommend then is if you're in this scenario that you should not stop your PPI just for that. Meaning, if you're on this medication and it helps and you have no reason to not be on it, don't stop it for just that reason. If you do, always make sure you talk to your doctor about other options to hopefully get things taken care of for you as well. All right. Perfect, guys. All right, I think that's everything. Guys, I want to thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. I look forward to seeing you guys on future videos. Tune in next week. If you're here in Lubbock, come see us where we can get you taken care of. If you like what you see, if you like what you hear, give us a 5-star review. The social media channels love this, and podcasts love this as well. But I look forward to seeing you guys on future videos. Thanks and take care.